Hi, this is Bennett Lipscomb. I'm the Vice President of Product and Panels here at Trinity Research. And thought today, this is the second anniversary of the beginning of the pandemic, that we would take a look back over some of the data we have at Trinity from these past 2 years. We've been tracking some metrics since the beginning. And I thought this week we would cover a question that caught my eye when looking over some of the data we have. So this question asks our panelists, our online panelists, to allocate out of 100% their concern levels for comparing their economic health of the country versus the public health of the country, and what are they more concerned about when it comes to the coronavirus. So looking back in March 2020, the very beginning, it clearly leaned towards the public health side of things. We had an average allocation of 56%. That being said, it was not overwhelming on the public health. Clearly, there were big economic concerns even from the very beginning, and we did have a pretty high allocation there. If we break out those allocations, 43% of respondents gave a higher allocation for public health as to only 19% for economic. And then about 38% of respondents were kind of splitting their vote equally. And if we move all the way to the present day, on our most recent look at the data, things have narrowed slightly. It still leans a tiny bit towards public health, but the split is much more even between the health concerns and the economic concerns. And that, again, you look at the breakdown of the allocation, and it has narrowed there as well. You have 33% that are allocating higher for public health, as opposed to now 26% for economic. So that's up 7%. And also those folks splitting their concerns has jumped up a little bit as well. So obviously, 2 years is a big gap, but we have been testing this question in between that period as well. So we look at the trend line, and this looks at our data points all the way through, not just the beginning and the end. We see that it did shift from the very beginning with that level of concern towards public health was probably at its peak towards the beginning, and then it drifted down a little bit as we got through further in through those 2 years. Looking at the moving over to the far right here with the October, the rise of Delta, the rise of inflationary concerns, you can see the move towards economic concerns being much, much higher, and actually overtook the health concerns a little bit back in about November. But recently, health concerns with Omicron's rise, the concern for health increased. So I thought this was a very interesting look at just one question we've been asking about COVID. Over the next month, we'll have my coworkers will give you some insights into some other questions we've been tracking over time. And if you'd like to see any other data on COVID or anything else that Trinity has to offer, head over to trinity.com. Thanks.